Hello friends, welcome back to my YouTube channel. So today in this video I'm going to discuss in detail about the dental caries. Okay, so I'll be making this into two parts, part 1 and part 2. Okay, so today in this part 1 I'll be going in detail about the definitions, classification, causes, pathogenesis, everything about the dental caries. Okay, stay till the last. I'm going to tell you the secrets about the something secrets about the dental caries. Okay, so let me start with this video. So what is the dental caries? Dental caries is a localized, progressive, multi post-eruptive destruction of dental hard tissues by acid produced by the bacteria. Okay, this is mainly due to the bacterial acid production. Okay, this causes the dental caries. Okay, so etiology, what are the causes of dental caries are mainly host like tooth morphology, deep, if there is a deep pit and fissures, plaque, enamel compositions. In that, if you have a low fluoride content, there is an increased risk. Okay, then saliva quantity will also manage for cause for the dental caries. Okay, microorganisms like Streptococcus mutans is the most initiation, then lactobacillus, then actinomycins for the root caries. Okay, these carbohydrates produces acid, lactic acid, pH drops and demineralization occur due to this bacterial growth. Okay, so next cause will be the diet due to high sucrose intake. Okay, sticky food, retentive foods are the most prone to the dental caries. Okay, time, length of the time is like if there is a plaque accumulation, if you have not gone for the any scaling or something, that may also cause for the dental caries. Okay, so next is pathogenesis and micro how it will happen. Like first it will cause the demineralization phase. Okay, in this phase what will happen, acidogenic bacteria lower plaque pH below critical pH 5.5. Bacteria acidogenesis lower the pH. Okay, then calcium and phosphate what dissolve the enamel. That pH what that will do, the enamel ka calcium and phosphate that dissolve. Okay, with white spot lesion, there will be the white spot lesion. Okay, that could due to the calcium and phosphate dissolve. Okay, next phase is progression in the enamel. Okay, so it what happen is that subsurface porosity develops. Okay, chalky appearance, like appearance you can see surface layer remain intact. Okay, that will be little bit intact. Okay, caries spread along the enamel rods towards the dentino enamel junction. Okay, then the enamel like caries from enamel rods, it will spread into the DEJ. Okay, next is progression in the dentin. In dentin what will happen at the DEJ, caries spread laterally. Okay, it spread laterally due to low mineral content. Okay, dentin involved includes translucent, which is dentin. Okay, then dark zone, then infected dentin. Okay, these are the three stages where dentin get involved. Okay, so next is pulp reaction. What will happen, might stimulate reversible pulpitis. Okay, if there is a deep caries, there will be irreversible pulpitis with the necrosis also. Okay, so next is classification of dental caries. Like what are the classification, how you will do the classification is based on location. It will be pit and fissure caries, smooth surface caries, root caries. Okay, so this is how the smooth surface caries look. You can see the first diagram. For second diagram you can see the pit and fissure caries. Third you can see root caries. Okay, so here also you can see pit and fissure caries how it look like, smooth surface caries how it look like, and root caries how it will grow. Okay, so next GV Black classification: class 1 pit and fissure. Okay, class 2 proximal surface of the posterior teeth, class 3 proximal of anterior teeth. Okay, so class 4 will be proximal of anterior including the incisal edge. Okay, class 5 will be cervical third, class 6 will be cusp tip or incisal edge. See here you can see. Okay, class 1. Okay, so class 2 how it has been involved. Okay, proximal surface. Class 3 is interproximal surface. Okay, class 4 is edges of the two surface. Okay, interproximal surface of the anterior teeth with incisal edge involved, you can see here. Okay, then cervical third will be the class 5. Okay, class 6 will be incisal or occlusal edges. Okay, this is how the GV Black classification look like. Okay, next, this is also the classification, you can draw these diagrams. Okay, so next here also you can see how it look: class 1, class 2, class 3, class 4, class 5, class 6. Okay, so next is based on activity. Okay, active caries will be there and arrested caries. Okay, next is based on spread: acute and chronic and recurrent caries. Okay, so this is how the stages. First, enamel caries, it will be on the tip. Okay, little bit it will enter the dentin. Okay, that is dental caries. Okay, these two are very painless, there will be no pain. Okay, you can go for GIC or anything. Okay, restorations. In third stage, what will happen, little pulp will be involved, infected pulp. So here from this stage pain will start, that is called pulpitis. Okay, next is periapical abscess. If untreated, it will cause the abscess in the root. Okay, this is the where caries get into the pulp. Okay, so next, how clinical features, how it will look. As I told you, white spot lesion. Okay, brown, black or cavitation, food lodgement, you can see sensitivity to the sweet, cold, bittering taste. Okay, and pain is advanced case. Okay, here the pain will be little bit, if the pulp is involved, then the pain you can see. Okay, black color discoloration also you can see. In radiograph, how it will be looking, triangular radiolucency in enamel. Okay, then spread of DEJ, how it will enter in the DEJ, you can appreciate in the radiograph. Okay, dental radiograph large clinically than radiographs. Okay, next is, here you can see how it look like. Okay, white spot lesion you can see in the first tooth. Okay, next tooth you can see progression into the enamel, then dentin, then you can keep progression in the pulp, then you can see pulpal involvement totally you can see, and here you can see the root caries. Okay, in the pulpal involvement you can see the periapical abscess. Okay, so clinically, what all the diagnosis you have to see, check for the first you will ask the patient when was the pain started, then you will ask for the you will check with the mouth mirror and probe for the how much cavity is involved, then you will take the radiograph, you will test for the adjacent tooth, if there is other tooth also get affected or what, you will check for the fluoride, if there is if any Peter fissure are there, you will ask for the diet. Okay, if there is anything they have more into diet like sucrose, that also you will ask in diagnosis. Next is prevention. So how you will prevent the caries, and you can go for the fluoride therapies, water fluorides, fluoride varnish, gel, mouthwash also you can get it. Okay, then if there is a patent fissure, you can go for patent fissure sealants. Okay, diet modification you have to do. If you are taking a lot of sucrose, you have to be in control. Okay, reduce the sugar frequencies. Okay, so that will cause the prevention of the dental caries. Okay, so maintain the oral hygiene properly, brush twice, use fluoride properly, then saliva stimulation, chewing sugar free gums you can use, manage xerostomia. To manage xerostomia, if less saliva secretion is there, you have to go for sugar free gums so that it can manage saliva secretions. Okay, so treatment, what are the treatment you can go initially, remineralization like fluoride and varnish is more than enough. Cavity lesions, restoration, as I told you, restoration is more than enough. Okay, if deep caries, then go for direct pulp capping or indirect pulp therapy. Okay, irreversible pulpitis, then you have to go for the root canal treatment. Okay, so dental caries is what is the basically what is this, like dental caries is a whatever multifractional disease caused by the interaction of host, bacteria, diet and time. Early diagnosis and preventive measures are the key to control these progressions. So early thing is the main for the prevention of caries. Okay, now in next video I'm going to go in detail for classification each like patent fissure, what is infant caries, acute caries, I'm going to go in detail. Okay, so stay tuned till the next video comes, and do like my channel, subscribe. Thank you.